10 crucial blood pressure measuring mistakes to avoid. Do your home blood pressure readings have you worried? Wondering if you're getting accurate results? In this video, we'll expose the top 10 mistakes people make when measuring blood pressure at home or at the doctor's office. Learn how to avoid these errors and ensure you get reliable readings for better cardiovascular health management. Errors are commonly made when people check their blood pressure at home, similar to those sometimes seen in doctors' offices. We are emphasizing these mistakes because they can lead to incorrect results. A falsely high reading might result in a misdiagnosis of high blood pressure or cause unnecessary worry. By understanding and avoiding these common errors, you can ensure an accurate reading, aiding you and your healthcare provider in making informed decisions about your health. Number 1. Placing the cuff over clothing. Putting the blood pressure cuff over clothing is incorrect as it can interfere with the cuff's ability to accurately detect and measure blood pressure. Clothing acts as a physical barrier between the cuff and the skin, preventing direct contact with the artery. This barrier can cause improper inflation or uneven pressure distribution, leading to inaccurate readings. Clothing presence can also alter the pressure needed to occlude the artery, with the cuff requiring more pressure to compress the artery through fabric, resulting in a higher reading than actual. Additionally, clothing can cause improper cuff placement, either too loose or too tight, resulting in inaccurate readings. Therefore, placing the cuff directly on the bare skin of your upper arm is essential to ensure correct inflation and deflation, providing an accurate blood pressure reading. Number 2. Arm not being at heart level. Taking a blood pressure reading with the arm not at heart level or with the hand hanging down is a mistake, as it results in inaccurate readings. Blood pressure is influenced by the arm's height relative to the heart due to hydrostatic pressure. When the arm is below heart level, gravity increases pressure in the arm, leading to a falsely elevated reading, potentially causing a false hypertension diagnosis or unnecessary concern. Conversely, if the arm is above heart level, the reading will be artificially lowered, possibly leading to undiagnosed or underestimated blood pressure levels. To ensure accurate readings, position the arm at heart level, ensuring the cuff's middle is at the same height as the heart. Proper technique includes sitting comfortably with a supported back, feet flat on the floor, and the arm resting on a flat surface at heart level. Ensuring the arm is relaxed and supported with the palm facing upward will help achieve the most accurate blood pressure readings, essential for effective cardiovascular health management. If you find this video helpful, give us a thumbs up and let us know which of these mistakes you've made in the comments section below. Also subscribe for more health-related content. Number 3. Leg crossing. Crossing the legs while taking blood pressure measurements is incorrect as it can lead to inaccurate readings and affect the assessment's reliability. Crossing legs, especially at the knees, can alter blood flow and circulation in the legs, resulting in variations in blood pressure readings. Specifically, crossing the legs can impede blood flow from the legs back to the heart, causing a temporary blood pressure increase. Consequently, the blood pressure reading may be higher than if the legs were uncrossed. Conversely, in some cases, crossing the legs might reduce blood pressure due to decreased peripheral resistance, but this may not reflect the individual's true blood pressure status. To ensure accurate blood pressure measurement, avoid crossing the legs and maintain a relaxed, neutral position during the assessment, minimizing factors that could artificially influence blood pressure readings. Providing healthcare professionals with reliable data for appropriate diagnosis and management of hypertension and other cardiovascular conditions. Number 4. Conversing during the check. Talking during a blood pressure check can influence readings in several ways. Engaging in conversation can trigger stress or anxiety responses, temporarily increasing blood pressure levels and yielding higher readings than the actual baseline blood pressure. Additionally, talking may induce muscle tension and altered breathing patterns, affecting blood flow and arterial constriction, further impacting measurement accuracy. Moreover, conversation can distract both the individual and the healthcare provider from the measurement process, potentially leading to inconsistent readings. The variability introduced by talking during a blood pressure check complicates the assessment of true blood pressure levels, highlighting the importance of maintaining a calm, quiet environment for accurate readings. Number 5. Lack of back support. Poor posture, particularly having an unsupported back, can significantly impact blood pressure readings during measurement. Sitting with an unsupported back often leads to slumping forward, increasing pressure on the abdomen and chest, hindering lung expansion, and reducing thoracic volume, requiring the heart to exert more force to pump blood against heightened vascular resistance. Additionally, poor posture can impede venous return by compressing veins in the abdomen and legs, reducing blood flow back to the heart, subsequently elevating blood pressure measurements. Postural changes disrupt the body's natural hemodynamic balance, potentially triggering compensatory mechanisms like increased heart rate and vasoconstriction to maintain adequate perfusion. Incorrect cuff positioning due to slouched posture can also contribute to inaccurate readings. Ensuring proper posture with adequate back support is crucial for obtaining reliable blood pressure readings and facilitating accurate hypertension diagnosis and management. Number 6. Excessively tight cuff. A too tight cuff during a blood pressure measurement can give a falsely high reading. An overly tight cuff squeezes the arm excessively, making it harder for blood to flow through the arteries, resulting in an artificially high blood pressure reading. The cuff should fit snugly around your upper arm, but not too tight. You should be able to fit one finger between the cuff and your arm. Ensure the cuff is correctly positioned on your bare skin with the bottom edge about an inch above the elbow crease. Number 7. Insufficient rest before measurement. Resting for 5-10 minutes before taking a blood pressure reading is crucial for accuracy. This rest period allows the heart rate and blood pressure to return to baseline levels after any physical activity, as even mild movements can temporarily elevate these parameters. Sitting quietly decreases sympathetic nervous system activity, reducing transient increases in blood pressure associated with the body's fight or flight response. This rest also helps mitigate white coat hypertension, where clinical setting anxiety temporarily elevates blood pressure. Resting normalizes blood distribution in the body, particularly in the extremities, impacting the blood pressure reading. Failure to rest before measurement can lead to elevated readings, capturing temporary increases from recent activity, potentially resulting in hypertension misdiagnosis, unnecessary medication, or further testing. Number 8. Presence of a full bladder. Checking blood pressure with a full bladder can significantly affect the reading, leading to elevated results. A full bladder creates discomfort and physical stress, triggering a physiological response that can temporarily increase blood pressure. The distended bladder stimulates the sympathetic nervous system, responsible for the fight or flight response, causing a rise in blood pressure. Additionally, the physical pressure from a full bladder on surrounding blood vessels can increase vascular resistance, further elevating blood pressure readings. To ensure accurate and reliable measurements, empty the bladder before taking a reading. This simple step avoids transient blood pressure increases from bladder distension, leading to more accurate assessments. Number 9. Recent caffeine or nicotine consumption. Consuming caffeine and smoking before a blood pressure measurement can significantly affect results, leading to elevated readings. Caffeine in coffee, tea, and some sodas stimulates the cardiovascular system, temporarily increasing heart rate and blood pressure for about 30 minutes to an hour. Similarly, smoking a cigarette causes a blood pressure spike due to nicotine stimulation of the nervous system, resulting in vasoconstriction, narrowing of blood vessels, and increased heart rate, lasting about 30 minutes to an hour. To obtain accurate readings, wait at least 30 minutes after consuming caffeine or smoking before measurement. This waiting period allows temporary effects to subside, ensuring the blood pressure reading reflects the individual's true resting state rather than transient increases from caffeine or nicotine. Avoiding these substances and allowing adequate time before measuring blood pressure is crucial for accurate and reliable assessment. Number 10. Single measurement for diagnosis. A single blood pressure measurement is insufficient for diagnosing hypertension. Blood pressure naturally fluctuates throughout the day due to various factors such as stress, physical activity, diet, and even the time of day. A single elevated reading may not be indicative of a person's usual blood pressure. For a more accurate assessment, take multiple blood pressure readings at each visit, spaced by a few minutes, and use the average. Additionally, consider home blood pressure monitoring or 24-hour ambulatory blood pressure monitoring to provide a more comprehensive picture of your blood pressure patterns. These methods provide valuable data points over time, allowing healthcare professionals to make a more informed diagnosis and recommend the most appropriate course of treatment. Remember, consistency and proper technique are key to reliable blood pressure monitoring. If you have any questions or concerns about your blood pressure or the measurement process, consult your healthcare professional. Thank you for watching. Don't forget to give us a thumbs up and see you in the next one.